Nurse practitioner, and I am very fortunate to work at a place called PACE Vermont, which stands for the Program of All-Inclusive Care for the Elderly. And I say I'm fortunate because it's actually given me a glimpse into what a single-payer system or a sanely organized healthcare system could look like. We are a capitated Medicaid and Medicare program, which means that all of our funding comes from the federal government, from the state government, to cover care for frail elders. That means that we get a certain amount of money for each of our patients based on their comorbidities, their illnesses, and then we have a team of healthcare professionals, everyone from doctors to nurses to physical therapists, etc., who get to make decisions about our patients' care based on what they need and what we feel they need. What a concept. We don't have to worry about whether a certain medication is going to be covered. We don't have to worry about whether a CT scan is actually indicated. We don't have to worry about most of the things that you're hearing about today from various professionals. And it means that we get to deliver rational health care. So I don't have any horror stories from my current experience as a nurse practitioner. However, when I was a student preparing to become a nurse practitioner, I saw plenty, and I'd like to spend just a half a second talking, or maybe half a minute talking about that about one patient in particular who I saw. I was working for my preceptor, who was a nurse practitioner, and we had a patient who came in and said that she had been severely depressed. She was having a really hard time getting out of bed in the morning. She worked as a nurse's aide, and she didn't have health insurance, nor did she have a very high income, because unfortunately that position doesn't pay a lot of money. And she said, you know, I've been on antidepressants in the past that have worked really well, but I ran out about a month ago, and I just can't afford to get more. Now, one of the questions you have to ask a patient who says they're severely depressed is whether they're thinking about killing themselves. And she said, yes, actually, I think about it all the time. Big, big, dangerous situation. And she asked if she could get some antidepressants through our office. We were able to give her a small sample, but she needed a new prescription, and she wasn't going to be able to fill it for at least a few weeks when she got some money from a family member. And it really struck me that rather than our healthcare system being a source of support, of comfort for a patient like this, which is absolutely what she needed, our healthcare system was an additional stressor. It was an additional producer of anxiety. And fundamentally, that's why I'm here today. I want to see Vermont lead the nation in providing the kind of care that helps rather than harms our patients. Thanks.